Well, you know, the Affordable Care Act did some good things. And, you know, I think you've seen the change even in this country with thinking about the opinions on the Affordable Care Act, given all the tumult over the last couple of months. But the Affordable Care Act, you know, I always look at things through an equity lens and through a structural racism lens. How does it layer? How does the implementation of a policy mitigate, reduce, eliminate sort of the racial oppression that's been part of this country's history? So I'm always looking for how does it achieve equity. So the Affordable Care Act was fantastic in many ways because it expanded insurance coverage, but it also left, at this point in time, about 28 million people uninsured. And if you just think about, well, what's the cost of that? Well, for every million people who are uninsured, there are 1,000 deaths per year. And so in the richest country in the world, the idea that we don't have something that's actually universally universal is a problem. It did cover expanded Medicaid, which for people who had no access to anything was a fantastic thing. And I saw many patients in my own clinic at Rush who got Medicaid as part of the expansion, whose lives were literally saved by having that card. And so, you know, I can say having an insurance card is, in anyone's mind, is way better than not having one. But it wasn't designed, it was designed to sort of say access to health insurance was the same thing as access to health equity, and it's not the same thing. So in my version of the world, we would actually have a single-payer healthcare system, which is improved Medicare for all, where no matter who you are in this country, that you can walk in the door, you've got the same card, because that at least gets to equality. Doesn't get to equity fully, but it does get you closer to equality. That said, you know, the good things was that we got many more people insured who were insured before. It was done in a way that was pragmatic and practical because no one wanted to take on the insurance companies. But other than that, I think it fell flat. And so, you know, of course I'm against the Republicans' version of repeal and replace, but I am in favor of replacing it with a single-payer healthcare system.